Welcome! This video is a just-in-time training to provide you with the basic details on how to set up and operate an emergency shelter in Baltimore County. In Baltimore County, shelters are mobilized and run by Baltimore County Department of Health and Human Services with support by the American Red Cross and other agencies as needed. A shelter mobilization team will be alerted as soon as the decision is made to activate an emergency shelter. In some cases, the mobilization team may be assigned to work the first shift of the shelter. Shelter staff should communicate with their supervisors and make any child or pet care arrangements. All staff, whether assigned to mobilization or operations, should plan to spend at least 24 to 48 hours at the shelter and pack a go bag accordingly. Your go bag should contain your agency identification badge, a change of clothing, toiletries, personal medications, a flashlight, cell phone charger, and comfortable shoes. A sleeping bag or blanket is also recommended. Baltimore County uses the Incident Command System, or ICS, for all emergency operations, and that includes emergency shelters. The shelter manager is the top person in charge of the shelter. They will be serving under the Incident Commander and Area Operations Chief at the Health and Human Services Department Operations Center, or DOC. If the Department Operations Center, DOC, is not activated, an HHS emergency liaison will be assigned to communicate with them for direction from HHS executive leadership. A safety officer may be assigned. If no safety officer is assigned, the shelter manager may assume this role. The logistics chief at the shelter handles all of the logistical support functions such as supplies and equipment, trash, custodial, and maintenance, tactical communications, and security. In most cases, physical security will be provided by the police department. The operations chief oversees the key operations of the shelter, including registration, cafeteria and feeding operations, dormitory, health services, and other key support services such as animal sheltering, child care, and shelter activities. Each operational unit will have a leader assigned. Staff designed to work in those units should communicate with their respective section chief through their unit leader. Section chiefs can bring issues to the attention of the shelter manager. Other staff should not go directly to the shelter manager unless it's a matter of immediate life safety. Tactical communications will be established via radio between the shelter, whose call sign is the location followed by the shelter name, such as Arbutus Shelter, and the Department Operations Center, whose call sign is Health Command, and/or the Emergency Operations Center, or EOC, who uses the call sign EOC Health. Additional two-way radios may also be utilized within the shelter itself to be used for internal shelter communications. During extreme disasters, amateur radio operators, or hams, may be utilized at the shelter. The logistics chief and shelter manager should be sure to include these volunteers as members of their staff during briefings. Lastly, a trained public information officer, or PIO, should be designated. If one is not provided by the county, only the shelter manager should perform this function. Supplies and equipment for the command staff can be found in the road case. Open all of the hinges and remove the lid. The lid has folding legs that allow it to become a folding table for the shelter command post. Road case also contains the supplies for the registration area, vests, lanterns and flashlights, and other items command and general staff may need. Registration should be set up close to the door, according to the floor plan, but leave enough space to set up a line queue. Security should be posted at the entrance. No weapons of any kind are permitted inside the shelter. In some shelters, laptops or tablets may be provided to assist with registration, but all staff should be prepared to use paper forms. Registration is divided into two processes. The first is the initial shelter intake. Anyone staying in the shelter must register by filling out the paperwork. After being registered, occupants will be required to wear a paper wristband and will be directed to the next screening stations. Those with limited English proficiency or those who do not speak English may require help filling out their forms. Your shelter manager can assist with language links or other tools available to help you. After intake, all shelter occupants will be directed to health screening in an area that affords some privacy. Nurses will perform 3 types of screening. First, all occupants will be rapidly screened for communicable disease. This is mandatory. Next, a health screening may be performed if the occupant wishes to do so. Based on local protocols, some occupants may need to be temporarily housed in a separate part of the shelter to prevent the spread of communicable disease. Health needs may include prescription medication refills, wound and dressing changes, catheter care, or help with a medical device. Health and medical requests should be communicated through the EOC health representative on duty to coordinate resources and assistance. Lastly, a functional needs screening is performed voluntarily. Functional needs can include a variety of items such as eyeglasses, large print forms and brochures, toilet chairs, walkers and canes, and many other devices. If an occupant has a functional need that cannot be immediately met at the shelter manager should contact the EOC health representative to coordinate how these resources may be obtained. The amount of supplies and equipment that arrive will depend on the size and duration of the shelter. In most cases, a shelter with 200 people or less will receive all functional needs cots, which will arrive on a cart, either a tall cart or a short cart. You will be provided with a diagram of how the cots should be arranged. It is important to leave sufficient lanes between sections to provide access for occupants, staff, and emergency crews. Because the dorm area takes the most amount of time to set up, it is recommended that you set it up as soon as the cash arrives. Work as a team. The first person pulls the cart and unloads a cot approximately every 4 feet. The second team member follows behind and opens the cot and sets them up. To set up a functional needs cot, carefully open the cot without pinching or catching the mattress in the hinges. Remove the mattress and place it on top of the cot. Ensure that the legs are fully extended. If your floor plan calls for ADA or bariatric cots, these are typically placed along the walls where there are electrical outlets. Place a folding chair at the head of each cot. Next, attach the number identifier at the foot of each cot. This will allow the shelter occupant to easily find their assigned space and will aid the health staff in finding those who may need follow-up visits. Using the measurement wheel, ensure that each cot's space has a 4-foot by 10-foot footprint. Ideally, occupants will be assigned a cot. Those identified by the Functional Needs Screening Unit as needing an electrical outlet for medical devices will have priority for cots near outlets. Families should be grouped together. For small children, floor mats may be preferable over cots. Once they have been assigned a cot, they will be provided with a linen kit that contains a blanket, pillow and pillowcase, and a sheet set. Use a marker to write their cot space on the outside packaging. Each occupant gets 1 set for the duration of the event. The schedule should be posted when the lights are to be turned off in the evening and turned back on in the morning. Use lanterns or Sialume light sticks to mark the exits. For late arrivals, guide them to a cot with a flashlight. If available, use the night setting red light to avoid disturbing those sleeping. The dorm unit leader should ensure that the lanes remain clear and unobstructed and assist the shelter occupants with any needs related to the dorm areas. Not all emergency shelters will have access to showers. If a shelter operation is anticipated to last more than 3 days, emergency management will coordinate the arrangements for portable shower units. Regardless of the anticipated length of activation, food and beverage are a necessity at all shelters. In Baltimore County, American Red Cross provides the much-needed support of food and beverage for the shelter. The logistics chief assigns a food unit leader who will run all food and beverage operations. Hand washing stations or hand sanitizer must be readily available for all cafeteria staff. Vinyl gloves should be utilized by all staff serving food. All local and state regulations regarding safe food storage and handling must be followed. At a bare minimum, bottled water and coffee should be made available. The type of food and beverage received will vary depending upon conditions and availability. Although not all meals may be hot, the shelter can expect to have 3 meals per day. If snacks are in limited quantity, the food unit leader may opt to distribute them in an orderly fashion as opposed to just leaving them out for self-service. Meal times should be posted in a public area. If the dining area cannot accommodate the entire shelter population at once, the food unit leader will work with the command staff to determine a schedule and method to schedule feeding shifts. Shelter occupants, particularly the elderly and those with medical and cultural needs, may require a special diet. Every attempt should be made to accommodate these requests when feasible. The logistics chief and shelter manager may need to contact an EOC representative to meet some of these requests. Alcoholic beverages are never permitted inside or on the grounds of an emergency shelter. Many shelter occupants may be underinsured residents or lack any insurance. As a result, they may have underlying health conditions that can be exacerbated by stress. In addition, they may not have taken their medications for several days as a result of the incident. A health suite should be established based upon the floor plan provided. In many cases, an existing nurse's office, such as those found in a school, may be used for this purpose. If a standard office is utilized, at least 1 cot should be set up in the health suite for patient use. A health and medical case will be sent with a cache that contains supplies and equipment for the health staff. Like the command road case, the lid also serves as a portable table. Occupants experiencing true medical emergencies should be sent to the hospital via 911. Examples of medical emergencies are chest pains, trouble breathing, abdominal pain, stroke, fainting, and injuries such as fractures due to a fall. Be aware, however, that patients who only require routine home health care, such as dressing changes, prescription refills, daily insulin, or a new oxygen cylinder, are not considered medical emergencies. Sending these patients via ambulance will quickly overburden the system's limited resources and are not often in the patient's best interests. Coordinate prescription assistance through the EOC's health representative, who may be able to coordinate assistance such as a pharmacy that delivers. There are typically 2 nurses assigned to a shelter. If they do not feel comfortable performing a task, they should alert the operations chief and shelter manager immediately so that assistance can be requested. Due to limited space and staffing, shelter occupants are advised to keep their medications with them at all times. If they're unable to do so, a locked box may be available in some locations. However, space is limited. Substance abuse can present many challenges to shelters. Staff should be alert to signs of distress, such as opioid overdose and severe alcohol withdrawal. Health nurses should render aid while 911 is activated. Smoking is not allowed inside any shelter. Use of marijuana and other illegal drugs is also prohibited. Many shelter occupants may exhibit signs of anxiety, depression, and critical stress. A social worker or other behavioral health counselor may be sent to the shelter to assist occupants who are feeling overwhelmed or distressed. Working in a shelter can be very stressful and take an emotional toll on staff as well. Staff should also consider using the buddy system and check in with each other periodically. If feeling stressed, take breaks outside if weather permits it. Avoid too much caffeine, junk food, or cigarettes, and try to get as much rest as you can. Two of the most challenging aspects of shelter operations are managing communication and boredom. It is important for the staff to be kept aware of the latest information. The shelter manager should schedule 2 briefings to coincide with shift changes, once in the morning and again in the evening. Staff briefings should be kept short and to the point, and be tightly facilitated to prevent becoming a complaint session. The outgoing shift should use the briefing to provide any critical information to the incoming shift. Community information should be posted on bulletin boards in a common space and in multiple languages if necessary. If feasible, the public information officer or shelter manager may schedule a public meeting to share information with occupants. If you have occupants who require an ASL interpreter or a language other than English, notify the EOC representative to see if the county has one available. Some shelters may have access to television sets. Charging areas for cell phones and tablets will also allow occupants to view information from the local news networks. Be aware that information during a disaster may be unreliable and in some cases contain rumors. A rumor control board managed by the PIO can help ease some concerns. Only the public information officer and shelter manager should speak to the media. The media should not be allowed into the shelter unless approved to do so by the director or deputy director of social services. Shelter staff should not post anything on social media related to the shelter operations, particularly photos of evacuees. Activities for children and adults will prevent boredom and improve morale. The shelter manager should work with the local EOC to determine if there are additional agencies and organizations that can assist. The shelter manager may face special circumstances that will require a high degree of discretion and judgment. For example, it may be necessary to designate a low stimuli room for people with autism. Registered sex offenders and those with restraining orders may require sending one of the parties to another facility. Other agencies may be able to assist with placement and transportation if needed. All shelter occupants should be treated with respect, dignity, and be provided access to shelter in some form. The logistics chief is responsible for ensuring that the basic support services are being performed, such as security, supplies, custodial, maintenance, and lighting. Maintaining a safe and secure environment inside and outside the shelter is extremely important. Security is everyone's responsibility. If you see something, say something. Private security and local police officers may be necessary to keep the shelter safe. Include law enforcement and security on any relevant staff briefings. A supply area should be established in a secure area and maintained by the logistics chief. The cache contains a supply cart, a linen cart, and functional needs carts. Upon receiving the supply cart, remove and discard the shrink wrap. Turn the pick bins around, allowing the logistics chief easy access to the supplies. Your initial supply cache will include a limited amount of diapers, incontinence supplies, feminine hygiene products, and other necessary items. Regular inventory of supplies should be taken daily in all areas and checked periodically to ensure there are sufficient quantities of necessities. Additional supplies can be arranged through the local EOC or through the Department of Operations Center. place the disposable shelter signage on the front doors. Signage should also be placed directing occupants to other critical areas such as the dormitory, cafeteria, health suite, and restrooms. The logistics chief should also ensure that trash is being removed and restrooms are being kept clean by custodial staff. Baltimore County Animal Services has 2 emergency trailers to mobilize a pet shelter. If feasible, keep pets in carriers or cages next to their owner, which will ease some of the anxiety of being in a shelter. It may be necessary to establish a second area or room for those with allergies or sensitivity around animals. The care, handling, and feeding of pets should be restricted to the animal owners and trained animal services staff and volunteers. Please note that a service animal is not a pet. Service animals are always permitted to remain with their owners at all times, unrestricted. The shelter manager will work with local officials to determine when the shelter should begin demobilization. Local agencies and organizations may work together to place residents in other temporary, short-term, and long-term housing solutions. Linens, pillows, and blankets, once used, will not be laundered but will instead be discarded. Occupants are permitted to take their used linen and blanket sets with them when they leave or relocate, or they may be collected and discarded as trash. And cots must be disinfected prior to packing up. Ensure that all supplies and equipment are inventoried and stored back into their appropriate case. Turn the supply bins back around, facing the back of the cart, and shrink wrap the unit. Medical waste should be disposed of according to local protocols. Contact the Department of Health liaison for guidance. It is important to track all of your hours and duties performed while at the shelter. Your supervisor can provide you more information on filling in your timesheet. This concludes the Baltimore County Health and Human Services Emergency Shelter Operations Just-in-Time training video. This video was funded by the Centers for Disease Control and Prevention's Public Health Emergency Preparedness Base Grant in cooperation with Baltimore County Emergency Management, American Red Cross, Maryland Department of Human Services, and Maryland Department of Health.